Welcome to For Your Health, a show brought to you by Green Peak Alliance, an organization that aims to build healthy communities in Vermont. I'm Elizabeth Kelsey, and I'm here with Dr. Mark Levine, Commissioner of Health for the Vermont Department of Health. In the United States, we've seen several deaths and thousands of lung injuries related to vaping. Today, we're going to talk about vaping, what it is, how we ended up with an epidemic of lung injuries, and how this issue has brought to light another epidemic, the fact that so many of our youth have become addicted to vaping. Welcome, Dr. Levine.
Nice to be here.
So can you tell us what is vaping exactly, and how does it differ from smoking?
Sure. You know, traditional smoking, whether it be a cigarette, a cigar, is really inhaling smoke from the combustion of tobacco products, from the tobacco plant. So with that comes nicotine. With that comes things like tar, which can cause some of those adverse effects like lung cancer and all of the other diseases we associate with traditional smoking. Vaping is a little more complicated. Basically, it involves inhaling what is termed a vapor, but really is an aerosol. And what's in the aerosol is sometimes well known, sometimes not well known. But all of the devices have several things in common. They have a charging element, which usually is heating up a fluid. The fluid may contain nicotine. The fluid may contain flavors and countless other things that we don't even know about in terms of the analysis of the fluid. There's usually a humectant like propylene glycol, which actually humidifies and allows this to go into a vapor or aerosol form. And then the individual who's using it inhales that and gets all those substances into their system.
Can you tell us about vaping-related lung illness we've all been hearing so much about?
Yeah, you know, we really have two epidemics going on side by side. We have in our youth particularly, especially middle and high school age youth, an epidemic of just vaping in general. And then on top of that, nationally, we have an epidemic of a severe lung disease related to vaping, which is quite new. It's only been in this calendar year, in the past 6 months or so. And it used to be called severe pulmonary disease associated with vaping. Now it's called E-Valley, which means e-cigarette and vaping associated lung injury. So what that illness is, pretty traditional symptoms somebody with pneumonia might have: shortness of breath, cough, chest pain, sometimes fatigue, sometimes preceded by some gastrointestinal symptoms like nausea, vomiting, diarrhea. Can occur in a very short period of time and become quite aggressive, or it can be kind of subacute over a longer period of time and then become more and more serious. The definition of being a case of one of these means that you've used the vaping device within 90 days of your symptoms. You've had the appropriate symptoms. None of the traditional forms of lung disease, like infectious diseases that cause pneumonia or other lung diseases, have been ruled in by the workup that the individuals had. And so there really appears to be no known cause for their symptoms. So they qualify because of their vaping for this categorization. And around the country now, there's well over 1,900 cases that have been reported. There's close to, but not quite, at last count, 40 deaths around the country. The age demographic of everyone who's had it is on the younger side, although the deaths are a slightly older group, but they're still what we would consider young people in terms of average age in 30s or 40s. And it's really been quite alarming, to say the least. Not only has it alarmed the public health community and the Centers for Disease Control, it got some notoriety because it was recognized by the White House as a significant problem, warranting perhaps some interventions regarding vaping devices, though we have not seen any occur yet. And of course, school officials, children themselves, parents, everyone's radar is up and concerned about this. And it's especially concerning to all of the above because there is no one cause that has been found as of yet. Mm-hmm. There are a couple of competing theories. One is that the data shows that the large majority of people who have been vaping and gotten this illness were using somewhat adulterated flavor pods. The flavors were usually in THC, which is the active ingredient in cannabis, fluid, and some of those were probably obtained illicitly. They weren't necessarily the manufacturer's problem. People were somehow tampering with the devices that they had, introducing these THC-containing fluids, and something in the last 6 months happened in terms of what the THC was in. One theory is that it was in a fatty oil, like vitamin E, which is one of our fatty vitamins. And some of the states that have provided data showed that the pneumonias people were getting were typical of things like fat particles being inhaled into their lungs. Recently, the Mayo Clinic has come out with another report not showing anything like that, but showing almost what they call the chemical burn of the lungs. And that's why this new designation, acute lung injury, came about, because it's very much an injury to the lung from a chemical exposure. What chemical is still unclear. So there are some competing theories and no real definitive notion of what it is. I suspect when it all kind of is figured out, there may not be one cause and one disease, but it may actually be a reflection of a few causes, perhaps producing a few different types of disease.
So it's still very much a mystery, and many people are alarmed for good reason. What kind of regulations have we had around these devices?
Yeah, so, since 2016, the FDA has been involved in some regulation of these e-cigarettes, just like with traditional cigarettes. But many feel that that regulation hasn't gone far enough, and it hasn't really attacked the drivers that are driving youth to this marketplace, and that something needs to be done rather quickly to take away the things that are attractive to youth about these devices. As I mentioned earlier, there are many different kinds of devices. They're all unified by having this charging area, a heating chamber, something to produce a vapor, and then having the fluids that go with that. The most popular among our youth are called Juul devices, which people have heard about on the news, I'm sure. Look like a memory stick that you would insert into your computer as the charging element, and then there's a small flavor pod that sits on top of that, and you inhale that. Most of those contain a variety of flavors. The reasons we're so concerned about them is the majority of youth who tell you that they've begun using these regularly say they got into it because of the flavors. Two reasons, really. Cool technology that's easily concealable, and literally thousands and thousands of flavors. All kinds of flavors, fruity flavors, creme brulee, you name it. They've made the flavor for it. And youth are very attracted to that. The third element that sort of seals the attraction and causes the addiction is that these flavors contain nicotine. The Truth Initiative surveyed youth and found that up to 37% of youth who began using these regularly actually didn't know there was nicotine in them. They just thought they were cool devices with great flavors and taste. So innocently, they got addicted without realizing how powerful a punch they packed. And it turns out the nicotine content of a flavor pod for Juul has about 200 inhalations or hits. That's equivalent to the same nicotine in a whole pack of cigarettes. So you could imagine if youth were using these rather regularly and not understanding how addicting they were, that they could use them so quickly and become addicted so quickly because they didn't know that they were so much more potent than a traditional cigarette might be.
Can you talk about how this epidemic and how these issues are affecting Vermont in particular?
Yeah, so I'll talk about the two epidemics. So the serious epidemic with people around the country actually getting very ill and at times dying, we have been spared a large morbidity with that. We've had only 3 cases out of the 20 to 30 cases that we've investigated that were reported by the medical community. None of those 3 cases have died, thank goodness. I can't tell you the specifics of each one for confidentiality and protection reasons for the patients, but the fact is they're consistent with that definition I gave you. And it's been a number of weeks since we've had a new case. So whether that means there's been a significant behavior change in Vermont that accounts for that or not, we'll begin to see. In terms of the general vaping epidemic, if you survey our high school students, you'll find that 12 to 15% of them will say they've used these devices within the last 30 days, implying that they may be beginning to use them regularly. I want to call to your attention the fact that we've been so successful with traditional, as they're now called, combustible cigarettes, that the rate of that age group using those is down to 9%. So this has actually come above the level that we had people using regular cigarettes in the high school age group. So it's a serious problem, needless to say, that we definitely want to be on top of.
With the young people, you talked about how some of them unknowingly were inhaling nicotine. But what are some of the other reasons, some of the underlying reasons that young people are doing this?
Well, I mean, it is a social connectivity thing as well. In fact, you know, though to buy a cartridge and the whole device may cost $30 to $40, youth often do that in pairs or groups and then share the materials. There's a certain coolness if you look at some internet sites with the way you can blow smoke rings and other forms and shapes. Though when youth are using these surreptitiously in the classroom, they also know how to keep the smoke in so no one knows they're actually using them at all. So I think all those reasons, you know, the power of addiction is very, very impressive to me. The most susceptible brains when it comes to addiction are our adolescents and young adults, which means anybody in the teenage years up to age 24 or 26. So that's a large age span. If you just talk to people who became addicted to regular cigarettes, 90% of them will tell you they started in those years of age. So the power of nicotine as a addicting substance cannot be underestimated. And though I don't want to unnecessarily alarm anyone, nicotine has been called a gateway drug, and there is some very recent evidence that nicotine further primes the brain of an adolescent to make them more susceptible to other addicting substances as well. So that's why we're so concerned about these.
What about treatment options for adolescents and adults? Do they differ for vaping?
Yeah, so they do and they don't. And I wish we had more science with which to give advice and to counsel people, because it turns out this epidemic of vaping has come upon the health community in the country so quickly. It's only a several-year phenomenon. It's not like when cigarettes suddenly got the Surgeon General's imprint saying, this could kill you, don't do it, but they've been used for decades and decades and decades. Vaping, that's not true of. It's come on very, very quickly. So the research about getting off of vaping is lagging behind, as you might expect. But some traditional approaches are still advocated and should be used. Counseling, for sure. There are websites to go to. There are physicians and nurse practitioners to go to. There are texting services one can go to, all of which provide a strong dose of counseling and advice. And that's really the first step. Most adults who can't do it on their own or with advice or cold turkey, as it's called, will then use what's called nicotine replacement therapy. either a patch, a chewing gum, a lozenge, something that will provide a lower level of nicotine than what they're accustomed to, but will ease their transition from using nicotine-containing harmful substances to stopping altogether. We still advocate for that with those who are vaping. We just don't have as much of the data behind it. We do know that many adult vapors are concurrent smokers, so they almost toggle between the two. With youth, we're not quite as clear on that, but we do believe that the youth can go both ways as well. And they may become less interested in vaping because of all the press it's been getting lately, but because they're still nicotine addicted, transition to traditional cigarettes, which is certainly the last thing we'd like to see. So I'd like them to all know that clearly use of nicotine replacement therapy we would advocate for. Now, if they're under 18, they're going to have to see a healthcare provider to be sure that they can get a prescription for that, because they can't just pick that up in a drugstore like an adult can at this point in time.
Can you talk about the prevention coalitions in Vermont and how they're working on this issue?
Sure. So, the Centers for Disease Control and other Washington agencies do provide states with some modest monies to enable them to help with prevention in general. And when I say prevention, it's done on a very large scale. It's not a one-on-one interaction in a healthcare setting. It's really trying to change a culture at times, trying to change what goes on in a community, trying to strengthen that community to be able to have policies in place that won't allow this rapid uptake to our youth, because those are who we want to prevent the most, needless to say. So a lot of our monies come through our tobacco control program and go out to what we call prevention coalitions. And these coalitions are fortunately regionally distributed throughout the state and help engage in public health programming. So for instance, there'll be traditional messaging campaigns that would go to youth. Most adults won't even know those exist because they're going to youth on the social media that they use and are very targeted to that audience. Then there are groups that we engage youth in to try to combat what we typically call the big tobacco playbook, which is how they get the population addicted to their products so that people buy them and the companies do well. So there's a campaign called Counterbalance, which is just what it says. It takes some of the deceptive activities of tobacco and tries to empower youth to be able to resist that just by understanding it alone and educating one another. There are groups called OVX for high school and VCAT for middle school that actually are youth foundational groups that work on educating their age demographic and even the adults, and again, trying to resist the allure of some of the products that are out there. There's an 802 quits line that anyone can access, no matter what age, no matter what addicting substance they're using. And then there's a parent site called parentupvermont.com. If you want to Google it, it's parentupvt.com, which actually provides parents a little bit of knowledge and skill in having those conversations with their kids that they never dreamed they would have to have about harmful substances, from nicotine to opioids and everything in between. So a lot of programming on the prevention front, if you will, which is really, really important.
There's so much new information coming out each day on this topic. How does the Vermont Department of Health stay on top of it and inform the public?
Yeah, so like any public health department, we're in close connection with the Centers for Disease Control in Atlanta and with many Washington health agencies. So we're very much up to speed and up to date on anything that's critical. Through my own professional organization as our state's health official, I have my own separate alert network as well as colleagues to tell me what's going on in their states that might not yet be happening in our state, but that we want to be on the watch for. So there's a lot of that going on. We put out health advisories to the entire clinical community so that clinicians are very versed in what's going on and what they can do about it individually and with their patient populations. We put out press releases. We do numerous interviews as well as programming like the one we're doing right now to try to really keep the public front and center and have real accurate knowledge about developments and things they need to know on a cutting edge basis moment to moment.
What would you say to people who still think vaping is unharmful or who say that it helps them quit cigarettes?
Yeah, that's an important thing because, we've gotten a lot of phone calls and messages, and obviously everyone's on high alert because of the death rate associated with this new illness that we've talked about. So our message has been consistently, if you're vaping, stop now. If you are thinking of doing it, don't do that now. But we're very sensitive to the fact that you can't just tell somebody, stop now, because they may have a significant nicotine addiction, which will make it challenging for them. And that's why I'm glad you asked me the previous question about helping people get off of these. Likewise, some people may be addicted to THC and have what we call a cannabis use disorder related to their vaping. And we know that they can't just stop, on a dime. They need to have help as well. And our healthvermont.gov website has some resources for them to connect with in the treatment community to make sure that they can access treatment quickly. But the fact is, the main message is don't vape. And I am sensitive to the fact that there's a little bit of unbalanced press regarding do vaping devices help you get off of regular cigarettes. And clearly, we don't want people smoking either. And it's hard to say there's a hierarchy of which is worse, one versus the other. But the fact of the matter is, there isn't firm scientific evidence yet that using vaping devices will help ease you off of traditional cigarettes. And in fact, in our personal experience, we've seen too many of the dual users who may think they're off of cigarettes, but then end up going back to them for whatever reason at some other point in time, or using both in lower amounts. So we would still rather people rely on nicotine replacement therapy and all of the other medications that are available to help people quit smoking, rather than use something that hasn't been well proven just yet. Believe me, if this gets to be proven and there's a safe way to do it, one would certainly want to advocate for it. But even then, we find that people are getting addicted to the vaping devices. So is that really helping them? We don't know what's in the flavor pods that they're getting. We do know that there are many chemicals that have been isolated when they're analyzed. Some of them the kind I used in an anatomy lab in medical school, like formaldehyde. That can't be good to inhale into your lungs and get into your body. We also know that there are fragments of metal that have been found in some of these inhalations. Things that are called volatile organic compounds. We don't know because not enough time has gone by if these are truly harmful and how long a time does it take to see the harms. With traditional cigarettes, we had years and years and years of knowledge about the fact that heart disease, stroke, lung cancer, emphysema are predictable outcomes related to the use of those. We just haven't had the time to collect that data, and the time hasn't gone by yet about the vaping devices.
And I wanted to ask, there are providers who have been recommending e-cigarettes as a way to quit smoking.
Yeah, I think less and less though, because not only our health department, but the Centers for Disease Control and others nationally are trying to, put some restraint on people just because of the fact that we don't know for sure.
Right, so advise them not to do that.
We try to be as credible and reputable an advisory organization as we can be, and we don't want to provide something because it sounds good, and the reality is it might be disproven later on. So we have to be careful with that.
Great. It's all been very interesting. Do you have anything else you'd like to add before we close?
No, I think that I would just share as a parent myself that parents should be concerned about both epidemics and become as knowledgeable as they can be. I want to put out a great shout out to our educational community because they were really taken by surprise by all of this. If you go to a principal and have them open up their desk drawer, you'll be shocked and amazed at the number of confiscated devices they have found. Youth education is going on, which is really, really a foundational important thing to have happen. So I just want to say that, these are real. And we need to be knowledgeable about them and have ways to intervene and prevent our generation of youth to be in any way adversely impacted by them.
Great. Thank you, Dr. Levine.
Thanks for having me.
This has been For Your Health by Green Peak Alliance. We'll close the show now by sharing some resources for you. Thank you for joining us.